What is the link between carotid artery disease and TIAs? Have you ever wondered how carotid artery disease relates to transient ischemic attacks? Understanding this connection is crucial for grasping the risks associated with strokes. Carotid artery disease is a significant contributor to transient ischemic attacks, often referred to as TIAs. These episodes are brief instances of neurological dysfunction caused by a temporary blockage of blood flow to the brain. The carotid arteries, which are located in your neck, are responsible for supplying blood to your brain. When these arteries become narrowed or clogged due to a condition called atherosclerosis, which involves plaque buildup, blood flow can be reduced or even interrupted. This interruption can lead to TIAs. The link between carotid artery disease and TIAs can be explained through two main mechanisms. First, we have embolism from carotid plaques. When atherosclerotic plaques in the carotid arteries rupture, they can shed small clots or debris that travel to the brain's smaller arteries. This process, known as embolization, can temporarily block blood flow and cause the symptoms associated with a TIA. This embolic process is a common cause of TIAs and ischemic strokes. The second mechanism is artery narrowing, also known as stenosis. When the carotid artery becomes significantly narrowed, it reduces blood flow to the brain. While a complete blockage can lead to a stroke, a partial blockage can result in transient symptoms typical of a TIA. Even moderate narrowing of the arteries can be linked to recurrent TIAs and an increased risk of stroke. TIAs often act as warning signs of underlying carotid artery disease. They indicate a heightened risk of a subsequent stroke, especially in the days or weeks following the TIA. Research shows that approximately 10 to 15% of ischemic strokes are attributed to carotid artery disease. Therefore, early identification and treatment of carotid artery disease after experiencing a TIA are essential to reduce the risk of a full-blown stroke. Diagnosing carotid artery disease in patients who have had a TIA typically involves imaging studies. These may include Doppler ultrasound, computed tomography angiography, or magnetic resonance angiography. These tests help assess the degree of arterial narrowing and the characteristics of any plaques present. Treatment options depend on how severe the narrowing is and the symptoms experienced. They may include best medical therapy, which involves using antiplatelet agents, statins, and controlling blood pressure. In some cases, surgical options like carotid endarterectomy or carotid artery stenting may be considered. In summary, carotid artery disease can lead to TIAs through both narrowing of the arteries and the generation of emboli that temporarily block blood flow to the brain. TIAs are significant clinical events that signal the presence of carotid artery disease and highlight the need for urgent evaluation and management to prevent a stroke. If you or someone you know experiences symptoms of a TIA, it is crucial to consult a healthcare professional for personalized medical advice and appropriate care.